Now, continuing our journey, obstetrics and gynecology. What are the importance of urinary dipstick, preeclampsia, eclampsia, everything decided by urine examination. When the proteinuria is more than 1 plus, it warrants further test. That's the reason any hypertensive woman comes into an obstetrical room, what they do is they test the urinary protein levels in order to detect the preeclampsia, right? Now, misoprostol, what is that? It is prostaglandin E1, which is used for medical abortion. Now, you need to know something called Leopold's maneuvers. What are they? Leopold has identified 3 maneuvers with which whether it is a vertex or a breach is identified. In that, the Leopold 3, third position, is the one which identifies the presenting part using the palpation just above the symphysis pubis. You will put above the symphysis pubis, you will know whether it is a head or the breach. So it is the Leopold's 3 of all the maneuvers which is important to identify the breach or vertex. Leopold maneuver 4, it will assess the descent of the fetus into the pelvis, right? So how you will know the descent? Suppose you keep, right? If you are able to feel the edge of the skull, that means it has not yet descended into the pelvis. So Leopold 4 is for descent, 3 is for knowing the presenting part. That's the point. Now, what is first stage of labor? It is begins with the true labor pain. Mala labor pain, so you have got false labor pain and true labor pain. So it starts with the true labor pain and ends with a full cervical dilatation of how much? 10, right? And what is the duration of the second stage of labor? Maximum 2 hours if it is primigravida. And if it is 1 hour, it is 1 hour in case of multigravida, right? Now, what is the third stage of labor? Once the baby is delivered, from that point up to the delivery of the placenta, usually it should be less than 30 minutes. Now, PGE1, E2, F2 alpha, what is their role? E1 is for uterine contractility. E2 is for cervical ripening. F2 alpha is for labor induction, right? Now, how do you manage the uterine inversion? So basically, we'll try to reposition the uterus which has come out. We give a uterine muscle relaxant. Which type of drugs are uterine muscle relaxants? They should relax the smooth muscle. So that is the reason beta 2 agonistic drugs are the uterine relaxants. And if all this fails, then surgically we need to intervene for uterine inversion, right? Now, episiotomy. One of the favorite questions asked is, episiotomy means what? You are trying to cut the vaginal introitus for the leaving of the baby, right? So it is done at 60 degrees from the midline. Midline together? Midline ki 60 degrees slow, you will do the cut. To prevent the extension of it to, extend a cut, it will extend up to anal sphincter. So that is the reason what will you do? Done at 60 degrees from the midline. So episiotomy angle is mediolateral episiotomy angled at 60 degrees from midline when cut, and final angle is 45 degrees. Now, who is a grand multipara? More than 4 times, right? Then what are the indications for lower caesarean section? Typically, tender uterus bleeding, fetal distress, whenever you are suspecting abruptio, then we need to do emergency lower segment cesarean section. Right? Then preeclampsia, IUGR, pre-rupture of membranes, fetal demise, chorioamnionitis, and chronic hypertension. They're all the indications. Then what is LOA position? The most common way the fetus presents is occipit anterior, not the occipit posterior. And left side, left occipito anterior position is the most common position, is what you need to basically remember. Nice to see 6 online classmates. I'm very glad to say from tomorrow we are going to have the class early morning 5 a.m. to 9 a.m. Please join. For next 20 days, we'll go like a beast, thirsty of the blood everywhere. Huh? Are you ready to compete with this old man, 52 years? You are all 52 reversed, 25. 25 versus 52. Let's see who has more stamina. Huh? Now, whenever vertex is coming out, what is the denominator? Denominator and the presenting part, occiput. Occipito anterior. So occiput is the denominator. Whenever the baby is born with the face presentation, mentum is the denominator. Whenever the baby is having brow presentation, forehead of the baby is the denominator, is what we should remember. Then what is the diameter that comes out in face presentation? Submento bregmatic diameter 9.5 centimeters, and mentum is the leading part. Right? Then vertex presentation, suboccipito bregmatic diameter, which is 9.5 centimeters, is what we need to remember. Right? And whenever the fetal head is undergoing engagement, which diameter of the fetal skull passes through the pelvic brim? Pelvic brim during engagement. It is the biparietal diameter of the baby is the one which is passing, is what we need to remember. So what do you mean by fetal station? Typically, we take ischial spine. Above it or below it is what we look for. So typically, station is measured in centimeters above or below the ischial spine, where at the level of the ischial spine you call 0, is what we need to remember. Right? Then, let's talk about the fetal heart monitoring. In first stage of the labor, how frequently? Monitor every 30 minutes in low-risk women and 15 minutes in high-risk women. In second stage of labor, every 15 minutes in low-risk and 5 minutes in high-risk. If you monitor too frequently whether cervix is getting dilated, you are introducing chorioamnionitis, infection. So that also you need to be careful. That's the reason this guideline is there. Right? Then, when will you start plotting? There will be a graph. How is the cervical dilatation happening? Only when the dilatation is more than 4 centimeters, then onwards you will start plotting every 1 hour whether it increased or not. That is during the active labor we do that. Okay? Then, Bishop's score, very important. So, whenever you are doing induction of labor by giving oxytocin and other uterotonic agents, you need to see whether the cervix is ready to propel the baby and deliver. That is assessed by the Bishop score. So the Bishop score, what are the criteria? How is the cervical dilatation? How is the effacement? What is the station of the baby? What is the consistency and the position? How is the fetal skull? Occipito posterior, occipito anterior, etc., etc. So tell me, what are the components of the Bishop score? station, consistency, and position. Okay. Now, there is another score called Clark score. The Clark is a cardiovascular score to know the fetal well-being, fetal heart rate, and how is the heart rate accelerating or decelerating, etc. A score less than 10 is a evidence of adverse outcome, is what you need to remember. Right? Now, whenever you are doing the fetal heart rate monitoring with every uterine contraction, what is that called? Cardiac tachography. In the cardiac tachography, you will look, the deceleration of the fetal heart rate is happening in sync with uterine contraction before that, or sometimes before, sometime in sync. That's called variable. So accordingly, early deceleration, late deceleration, and variable deceleration, all in relation to the uterine contraction and the fetal heart rate pattern. Early deceleration, why does it occur? Head compression. When our contractions are happening, head get compressed, that lead to early. Early means early in relation to the uterine contraction. Deceleration is whose deceleration? Fetal heart rate. So early deceleration, head compression. Late deceleration is uteroplacental insufficiency. Suppose if the blood supply from the mother to the baby placenta is like cord, that for example, the uteroplacental insufficiency. For example, eclampsia, and on all these conditions, the uterine blood vessels become constricted. So there you get late deceleration. Variable deceleration indicate the cord compression. Cord compression. Right? So for you to call deceleration, what is the criteria? Whenever the fetal heart rate is more than 15 beats per minute dropped in a 15-second observation period, that is definition of deceleration. So basically, you are parallelly monitoring the uterine pressures, you are monitoring the fetal heart rate, and you see more than 15 beats per minute of drop of the fetal heart rate in 15-second observation. And that deceleration in sync with uterine contraction can be early, late, or variable. Early is head compression, late is uteroplacental insufficiency, and variable is cord compression. Good into that? Football is calling, huh?
Oh, yeah.
Football is calling.
No, they don't have extra players also. That's why.
No problem. Football doesn't stop. Our lives, football is running here. Now, less than 4-hour rule. What is the meaning of it? In primigravida, if descent is less than 1 centimeter per hour, or dilatation is less than 1 centimeter per hour, right?
Yeah.
And if the labor is taking less than 4-hour dilatation per descent, the progress of the labor is less than 4-hour dilatation per descent.
Yeah.
That defines the less than 4-hour rule to call abnormal labor. If descent is less than 1 centimeter per hour or dilatation less than 1.5 centimeter per hour, and the abnormal labor will progress if less than 4-hour dilatation per descent, that is called less than 4-hour rule. Please don't forget. So what is the most accurate parameter to calculate the gestational age before 14 weeks? Crown rump length. So it is the most accurate. So how can you calculate the gestational age? Crown rump length 10 centimeter plus 6.5 will give you up to 14 weeks. 14 weeks వరకు gestation కావాలనుకోండి, Crown length is suppose is 5 plus 6.5. 11.5 weeks is the gestational age. That's how you use the crown rump length, which is the most accurate measure. Okay. Now,
Crown rump is like around this.
Kenichi,
For the
the sacral prominence in the varaku.
okay. Yeah.
Clear, doctor? Now, if you look at calcitonin, parathormone, etc., neither of them will cross the placenta. This is one of the favorite questions. Will they cross it? Now, coming to the hematopoiesis. When is the liver hematopoietic agent? 6th week. And liver forms bile by 12th week. Right?
Yeah.
Then, when will transvaginal ultrasound will find the fetal cardiac activity? By 6th week.
Yeah.
How frequently the HCG will be doubling?
Daily.
My football is also calling.
Daily. Oh.
There is one elderly patient. She has got obstructive sleep apnea.
Okay.
Her son is a RTO.
Okay.
My old patient.
Yeah.
I said, I'll come. Let me settle this and come.
Yeah.
I'll go.
Okay. Right.
Right. Huh. So what is the doubling time of HCG? It doubles every 48 hours. Early in pregnancy. Ekkada football?
Road number 10, Jubilee.
దగ్గరే.
Yeah.
అంటే క్లోజ్డ్ దీంట్లోనే.
Yeah. Six weeks.
ఇట్స్ నాట్
Like smaller.
ఫిఫా కాదు కదా.
No, full size girls.
కాదు. ఇట్స్ నాట్ వరల్డ్ కప్ కదా.
No.
Oh, I thought you are participating in World Cup. One player is missing. No problem. So HCG doubles every 2 days early in pregnancy and peaks by 10th week, then falls. Okay, doubling time is a favorite question. Every 48 hours. Suppose ectopic pregnancy.
Yeah.
How will you identify? You will do the HCG. Then after 48 hours, you will once more do.
Yeah.
If the value is not doubling, that means it is not intrauterine pregnancy, but ectopic pregnancy or a non-viable pregnancy. That's how doubling time is being used.
Yeah.
Okay. Now, who produce HCG? Syncytial trophoblasts. Right? HCG. And that's the whole story. Okay. Now, how much radiation can lead to fetal malformations? 10 rats. Most risky period, 8 to 15th week. What is the quadruple test? చెప్పినా కదా మొన్న 4 parameters. AFP, HCG, estriol, PAPA. Those 4 को टेस्ट करे तो क्या बोलते हैं? Quadruple test. Right?
Yeah.
Now, what is the triple marker? Mother's serum, AFP, HCG, and estriol. All the 3 will be low, then you call Down syndrome. AFP is high, then neural tube defect, omphalocele, and gastroscus. Will you remember this?
Yeah. If all 3 are down, then Down syndrome.
All 3 are Down syndrome. Easy to remember.
Yeah.
AFP high, then it is a neural tube defect, omphalocele, and gastroscus. In trisomy 21, how will you identify when you do ultrasound? If the nuchal translucency is more than 3 mm, there is a short femur and the bowel is echogenic bowel. Why? Because Down syndrome babies will have risk for meconium ileus and all these complications. Hence, there's an echogenic bowel.
Yeah.
Now, what are the ultrasound markers of trisomy 13 and 18? cystic hygroma, renal anomalies, and holoprosencephaly. So what is holoprosencephaly? Review in the Google.
Okay.
Cystic hygroma. Here there is a cystic swelling in the neck because of that lymphatic accumulation, which is called cystic hygroma, congenital. So renal anomalies can be found when you do ultrasound. Holoprosencephaly, cystic hygroma, they're all typical ultrasonic features in trisomy 13 and 18. When is the ultrasound based dating of the gestational age is best time? First trimester lo ultrasound is most reliable for gestational dating. When will you do chorionic villus sampling? Days గుర్తుపెట్టుకోవాలప్పా. Strictly.
Yeah.
So it is typically done 10 to 12 weeks and it carries 1% risk of fetal loss. In order to find these genetic abnormalities, we do chorionic villus sampling, especially previous pregnancy if it is having any chromosomal abnormality. Right?
Yeah.
When are the chromosomal abnormality responsible for miscarriage in which trimester?
Second. No.
Tappu.
Um,
First trimester.
oh.
Second trimester, structural abnormalities.
Okay.
Hmm?
Yeah.
Like cervical incompetence.
Yeah.
Even second trimester.
Yeah.
And APLA, antiphospholipid antibody syndrome.
Okay.
ఇవన్నీ కూడా సెకండ్ ట్రైమిస్టర్. షార్ప్ చెప్పాలి ఆన్సర్లు. 20 రోజుల్లో పరీక్ష,
Yeah.
రేపే పరీక్ష, శ్రీరామ రక్ష, తప్పితే శిక్ష, తొక్కుతావు రిక్ష. A poem dedicated to our Viraj Madhav Reddy. శ్రీరామ రక్ష, రేపే పరీక్ష, తప్పితే శిక్ష, తొక్కుతావు రిక్ష. खेलते చదవండి.
Yeah.
You got a company of me, no?
Yeah.
There itself is half your success already determined.
Right.
You have got a good retaining capability. So, ఇంకొక 30% అడగొట్టేశారు మీరు. Plus, you have a humongous stability, which is missing in many people. 10% అక్కడ కొట్టారు, 90 వరకు వచ్చేసారు అక్కడికి. 50 మీ ఇక మీ ఎఫర్ట్ ఏం లేదు ఇవాళ. 50 మీ 30 is, what is the 30 we said? You have a good retaining capability. And zero tension, 10%.
Right.
ఇంకొక 10% చదువు బాబు,
Yeah.
రివిజన్ చేయి, నా పుణ్యం ఉంటుంది.
Yeah.
Then chorionic villus sampling, typically done between 10 to 12 weeks. ఎప్పుడు amniocentesis చేస్తాం? 15th, after 15th week.
Okay.
కొంచెం ఎర్లీగా డిటెక్ట్ చేసి అబార్షన్ చేసేద్దాం అనుకుంటే 10 to 12 weeks. Okay? Then intrauterine fetal death. Why does it happen? The most common cause is idiopathic. Doctor is idiot, patient is pathetic. Right? Then what is Robert's sign? Really, it is a very sad thing, you know.
Yeah.
They never expect why my baby died.
Yeah.
They come crying emotionally. But after the baby is born, he will study or not. How serious he will be? When will the seriousness come in the baby? So many problems. To become pregnant is challenge. Healthy baby challenge. That baby settling in life is challenge. See? Those people who don't marry are happy. Now, Robert's sign. So what do you mean by Robert's sign? Whenever the baby is dead, no?
Yeah.
There'll be a gas in the great vessels of the baby. There'll be gas in the great vessels of the baby, dead fetus. So, if you take an X-ray, you can identify the presence of the gas in the great vessels of the dead baby 6 to 8 hours after the baby is died is called robot sign. Macrobots అంటే మెనువర్ ఏంటది? పినార్డ్ మెనువర్ ఏంటి? మారిషియస్ సిమిలివీట్ మెనువర్ ఏంటి?
Like Roberts is hyperflex the hips, lithotomy position.
వెనకటికి మీ ఇలాంటి కింగ్ ఒక ఆయన ఉన్నాడు. ఎవరంటే ఆయన క్వీన్ ఎలిజబెత్ వల్ల పెద్దనాన్న గారు. He fell in love with a American widow.
Right.
Widower కాదు, divorcee.
Yeah.
So everybody came and said, all ministers, priests, everybody will come. No, it is not right for you to marry that American divorcee. You are the king of England. అంటే ఎట్లనైతే రివిజన్ చేయాలి, మాక్ టెస్ట్ చేయాలి, మనము తప్పకుండా పాస్ కావాలి అని పాపం చెప్తుండే. విన్నాడు. మిడ్ నైట్ అయింది. మినిస్టర్ చేంబర్లే నా అసముంటోడు. మా రాజుగారు మీరు ఇట్లా చేయాలి అట్లా చేయాలని చెప్పిండు. చెప్పి ఇక నిద్ర వచ్చి అని యాన్ చేసిండు. ఎవరు? మినిస్టర్ చేంబర్లైన్. గాట్ అప్. నో అమౌంట్ ఆఫ్ yelling and yawning can change Prince Charles. I give my crown to my younger brother. And poesesi, he renounced the crown and went and married the American divorcee. Villa Pednana, Elizabeth. Atlunadi. ఇంకా నాకు 10 minutes టైం ఉంది. మీరు ఏమన్నా కూడా 6:57 10 minutes టైం. So, doctor, Praveen is asking, how can we join live? I will post the YouTube link. Right? Nice to see Deepika, Praveen, Jalsan, everybody who are online. Good, doctor. Now, cord prolapse. Why will umbilical cord go around the neck and people die? Malpresentations like transverse lie, footling breach. First he is coming out, putting his leg out. Then the cord will catch hold of his neck. Similarly, long cord, if it is there, polyhydramnios, preterm labor, they're all the causes of cord prolapse. Yeah. Think like an obstetrician, chief obstetrician. Right? So, by which day pubertal period, uterus become pelvic organ? By day 10. మనకు అక్కడ కూడా ఇట్లాంటి అరేంజ్మెంట్ చూడండి. సో వి బోత్ ఆర్ ఆపోజిట్ ద ఇది. దెన్ ప్యూర్పెరియంలో వెన్ డు యూ కాల్ pathological fever? If the fever is more than 100.4 degrees after 24 hours postpartum, then that defines the temperature cutoff to call it as a pathological puerperal fever. All pregnant women after delivering the baby will develop fever. It's called puerperal fever. But it is called pathological after 24 hours. First 24 hours, after 24 hours, then you call pathological. What is the most common cause of puerperal sepsis? It is the endometritis, inflammation of the endometrium, commonly due to anaerobic streptococci and gram-negative rods. ఎర్లీ మార్నింగ్ కొంచెం సౌండ్ ప్రూఫ్ ఉంటుందా మీ రూమ్ కి? లేకపోతే నా వాయిస్ కి అందరు లేచి కూర్చుంటారు ఇంటి పక్కన వాళ్ళు? అట్లీస్ట్ యువర్ డాగ్ షుడ్ నాట్ బి ఆఫెండెడ్.
Or we can even do it here also, sir. Anything, whichever. Ikkadu చేసుకోవచ్చు. ikkade.
మీరు ట్రైన్ ట్రావెల్ చేసి రావాలి లేవరు నేను కూడా లేదు.
Anything, whatever.
Which one is your preference?
I don't mind any either. Both are same for me.
చూద్దాం ఇంట్లో.
Okay.
Preference is you come to my home and stay. That's what I proposed here.
Okay.
But that's more easier for me.
Yeah.
We can also play football, cricket, everything.
Yeah.
So, placenta previa. How do you deliver? Generally, we let the pregnancy go up to 38th, 39th week, no? 38th week. కానీ ఎప్పుడైనా ప్లాసెంటా ప్రివియా ఫిట్ ఇస్తే 36 to 37 week के बीच में खत्म करना to prevent antepartum hemorrhage. How do you identify placenta ecreta, where the placenta is deeply routed into the myometrium? It is best diagnosed by ultrasound with Doppler. It will show a clear zone of separation. Normally, which layer will be absent in ecreta? Little layer.
Okay. Yeah. Between the
Long ago, in the last life, I told you.
Yeah.
Next comes fundal height. Uterus seat at the level of the umbilicus by 20th week of gestation. Then, when is femur length is used for estimate of gestational age? First trimester is all crown rump length and ultrasound. And femur length is the one reliable in the third trimester. And second trimester, what is the best way to assess the fetal gestational age? BPD, biparietal diameter, is the best one.
Yeah.
Since when? After 14 weeks, it is used in second trimester, right? Then different types of lochia. Already we finished this. 0 to 4, red colored rubra. 5 to 15, serosa. 15 to 30, alba. When do you call preterm labor? Any labor before 37 completed weeks is called preterm. Anything more than 42 weeks is called postterm. Right now, I am in postterm. June 15th అనుకుంటే ఇది July 25th పోతుంది. Now, lochia is also over. Now comes iron. Upper limit for iron intake, 45 milligram per day. How many antenatal visits a woman should ideally have? First in 16 weeks, second is 24 to 28, third is 28 to 32, fourth is 36 weeks. Okay? But WHO said 8 visits. First in first try, second in second try, fifth in third try. But you need to increase in third trimester. 30, 34, 36, 38, 40. Okay? Nowadays, nobody is taking it to 40. Now, how do you define iron deficiency in pregnancy? HB less than 11 if it is first and third trimesters, less than 10.5 if it is second trimester. Is the pregnancy a state of physiological anemia? Yeah. And there is also a dilution. RBC mass, plasma volume, if you take, plasma volume increases more than the increase in the RBC mass. That's the reason hematocrit will fall, and it is a state of hemodilution is the pregnancy. Right? Now, what are the renal changes in pregnancy? Increased GFR, increased RBF, renal blood plasma flow. Then physiological hydronephrosis is very common because the growing uterus, no? It will typically be more on the right side, this thing. That's the reason right side ureter is at compression, leading to right hydronephrosis is more common. Glycosuria is very common. Okay? Now, if there is a atonic PPH, what will you do? Uterine artery ligation chest padayalsi vastadi. What is the most common cause of postpartum hemorrhage? It is uterine atony. So atonic PPH is treated with uterine artery ligation. And we do internal iliac artery ligation for severe PPH. Huh? So when we do that, okay, you are controlling the bleeding, but it can also suffer ischemia, no?
Yeah.
So who will take the collateral flow? Middle rectal artery will reverse. Middle rectal artery's reversed flow will prevent ischemic necrosis. Coming to adenomyosis. What is adenomyosis?
Polyp.
Ah.
Oh, growth of endometrial tissue.
Ah.
And
Ectopic endometrium in the myometrium. Boma
yeah, they are on this side. Growth of endometrial tissue in myometry.
Another?
Yeah.
Okay. First shot lanle mari.
Yeah, second, that's what I said.
So dysmenorrhea, menorrhagia, uterus is bulky, boggy, symmetrical, best diagnosed with transvaginal ultrasound. There are two ways of teaching. I do actually both the ways. One is friendly, inspirational and all.
Yeah.
Second is ask question, quiz and then break.
Yeah.
That's usually me mida.
Yeah.
I had been handling it too gently. Huh? That's important.
Yeah.
Spardhaya vardhate vidya. Only when you are every day having some amount of Q&A, you will be inspired to study.
Yeah.
Especially with a guy with such a stunning retentive capability, no flattering. I would have chiseled you much more, is what I felt today. Thank God, still 20 days is there. So be ready, tighten your seat belt for a turbulent flight. Now, what is the definitive treatment of adenomyosis? Total hysterectomy. Clear, doctor?
Yeah.
So, okay. All right. So, for today, we'll take a break, and tomorrow, 5 a.m. to every day, 5 a.m. to 9 p.m. I'm all yours. And study and come at 52 versus you at 25. Who is going to show more perseverance, persistence for the next 20 days? Let us take it as a challenge. Thanks for joining.